Hello and welcome today to this third video in a series about gestational diabetes. Remember, none of this is individual medical advice, but you need to see your doctor or midwife. In the first video, we tried to find the big overgrown babies who are the foundation of the gestational diabetes enterprise. In the second video, we looked at the evidence to decide what a benefit treatment had or didn't have. In this video, we're going to look at the information that's provided by governments, health departments, expert bodies to anybody, but particularly to expecting parents, about what benefits having the treatment for a few months will have for them and their babies. And we're going to compare that information provided with the evidence and just to fact check that it's all true. Now, it's possible that some of it may not be true, and if we find that there is disinformation or misinformation, at the end of the series, what I'll do is I'm going to award places from first to fourth for the most imaginative or the greatest volume of misinformation or disinformation. You can disagree with me, and of course you can you can look back at the evidence. Remember, in the first couple of videos, I showed lots of meta-analyses. You can look at those if you like, or what I'm going to do today, just to make it easier or simpler, is use one source as much as possible, and that's a summary of the evidence by the World Health Organization in 2013. If that summary doesn't contain what we want, we'll look at other sources. Again, if you disagree with me, you can award your own places for the disinformation medal. Now, just to summarise the treatment benefits as we looked at in the last video, treatment of gestational diabetes does three things and three things only. One is it decreases the growth of babies, and it decreases the growth of all babies: big babies, middle-sized babies, small babies. Obviously, there's a decrease in large babies. However, there's no decrease in any of the bad things that could be associated with large babies, no improvement in outcomes. The second thing it does is it decreases what's called shoulder dystocia. So if you treat 49 women for 3 or 4 months for gestational diabetes, one of those women won't need to have various manoeuvres to help deliver the baby's shoulders, such as flexing the mum's hips, moderate traction, rotating the baby's shoulders around. Now, shoulder dystocia can have very bad consequences, injuries to the baby, injuries to the mother, but gestational diabetes treatment makes no difference at all to any of the outcomes, the bad outcomes. Third thing it does is it decreases hypertensive disorders. So it can include what's called preeclampsia, which can be very bad and has serious consequences for the mum. But again, it decreases the number of blood pressure measurements. If you treat 10 to 20 women, one of them will not have a blood pressure measurement over 140/90. Makes no difference to any of the bad outcomes associated with it. Sorry to be rushing this through, but I'm just sort of recapping on the previous videos. Okay, so for this video, we're going to head around the world and we're going to start in the United States. Let's go. Well, the American Diabetes Association points out that it's critical to start treatment quickly because gestational diabetes can hurt you and your baby. And as long as you stick to the treatment and do what your health team tells you, you'll have a healthy pregnancy. But the best thing of all is the American Diabetes Association is there to help. So what can you fix if you do what your team tells you? Well, there's the fat baby. We talked about that in the first video. Gestational diabetes babies are about 119 grams heavier on average. Treatment decreases their size by 110 grams. Baby girls by only 30 grams. Most of that's lean mass, not fat. And there's no change in any harmful outcomes or consequences. So we'll leave that aside. Damage to the shoulders. Very low blood glucose levels at birth, higher risk for breathing problems, and the children become obese. Children and adults at risk of type 2 diabetes if you don't have treatment, but treatment will fix it. Well, is that true? Let's see what the referee says. Well, the referee today is the World Health Organization. The citations here, which I've written on it, and I apologise for all the other scribble. This is from a 2013 summary of the evidence, and inside there are a number of tables, and table 8 deals with the children or their babies, and over here in the summary of findings is the effects of treatment. So the American Diabetes Association said treatment would fix breathing problems. Well, here we are, respiratory distress, treatment effect, not significant. It said it would affect newborn hypoglycemia, the American Diabetes Association. The effect of treatment, not significant. What else was there? Well, there was birth trauma. I remember shoulders, damage to the shoulders, that's birth trauma. Again, treatment, not significant. And then there was long-term babies becoming fat and getting diabetes as adults. Well, they talk about diabetes later in life, but this is for the mothers, table 9, and they mention that there's no treatment makes no difference to the mothers. For the children, we'll have to look elsewhere because they don't deal with it. So let's look at the follow-up of the original treatment trials. So there were 2 main treatment trials. This is one of them. And the follow-up of the children found no result in BMI at 4 to 5 years of age. This is the other treatment trial. A follow-up of those children. No reduction in childhood obesity or metabolic dysfunction. And this is a follow-up of the mothers of that study. A follow-up of the mothers of one of the treatment trials. And for the mothers, no discernible impact on subsequent diabetes or obesity in the mothers. Yeah, that's a bit disappointing, isn't it? Most of that doesn't seem to be true. Well, the American Diabetes Association, at least, is here to help. Although, wasn't it Ronald Reagan who'd something like the 9 most terrifying words in the English language are, I'm from the government, I'm here to help. Anyway, let's see if we can find something a bit more accurate from the United States. What does the US Health Department say about gestational diabetes? Well, if you don't control it, it can cause your baby to grow very large. We've talked about that, haven't we, already? It can injure nerves in the shoulders, break her collarbone, have brain damage. We've talked about trauma. We've looked at trauma, the evidence from the WHO. No difference from treatment to trauma to the baby. Low blood sugar levels, we've looked at that. The referee says there's no change with treatment. And more likely to become obese, etc. Referee rang the bell on that one. Turn the page. Now, if you don't control it, you'll have problems during delivery. I'm not sure what they mean there. They could be talking about shoulder dystocia. And remember that we talked about that in the first 2 videos, and even though there's a decrease in the diagnosis, if 49 women are treated for diabetes, 1 woman won't have various manoeuvres like flexing the hips to help deliver the baby with a delay of a couple of minutes. No difference whatsoever with treatment to any harmful outcomes to the mother or the baby. Caesarean sections, well, that's a new one, so we'll need to look at the evidence for that. Take longer to recover from childbirth, well, there's no evidence either way. No one's looked at that, so that seems to be a figment of someone's imagination. Preeclampsia, we've looked at in the first 2 videos. There's certainly a decrease in, if you treat 10 to 20 women, 1 woman less will have blood pressure measurements over 140 on 90, but no difference at all to any harmful outcomes. If you work with your doctor, you'll prevent these problems, and best of all, you'll be happy. So let's look at caesarean sections, was the only new thing really. This is what the referee says. Caesarean sections, treatment, no difference. Yeah. Well, the CDC doesn't seem to be much help in the area of true facts, but it's certainly helping the US look pretty good for an award at the end of the video. Let's keep moving. Let's check out the American College of Obstetricians. They wouldn't tell us anything that's not true, would they? So they reassure us that if you keep your blood sugar under control, you'll reduce the risks to you and your baby. What are the risks that will be reduced? Well, problems with breathing. Well, we've actually looked at that. That's not quite right. Jaundice, that's a new one. Low blood, well, that's not right either, is it? Birth trauma, well, we've checked that, and that's not right, is it? Damage to the shoulders, that keeps coming up, but no, that's not true, is it? Here's a new one, admission to a special care nursery. Does treatment decrease that? We better check on that. And stillbirth is obviously very important. Does treatment decrease stillbirth? Over the page. What about labour difficulties? Again, I think probably they mean shoulder dystocia, which we've talked about. Caesarean birth, we've talked about. It doesn't decrease that, does it? Heavy bleeding after delivery or postpartum hemorrhage, we'd better look at that. And severe tears in the vagina. This sounds very bad. This is very scary. They seem to be trying to scare us. I don't know. We better see if that's true. Does treatment decrease this? They've also mentioned this, which is even more scary. That's not studied anywhere, so I think they must be just imagining or making this one up. Let's see what the referee says. Perinatal mortality or death of babies, stillbirth. How much difference does treatment make? Yeah, not significant. What about admissions to the intensive care nursery, which they mentioned? Treatment, not significant. What about high bilirubin or jaundice? How much difference does treatment make? Not significant. The World Health Organization doesn't mention postpartum hemorrhage or those severe tears between the vagina and anus. For that, we'd better look at one of the treatment trials. This is one of the major treatment trials. So any perineal trauma, this is what we're talking about. How much difference does treatment make? This is the treatment group. This is the untreated group. Untreated group, 50%. Treated group, 52%. No difference. Postpartum hemorrhage. Treated group 6%, sorry, untreated group 6%, treated group 6%. No difference there either. So fact-checking the American obstetricians, yeah, not quite as reliable as we thought. Well, what the American obstetricians sort of lost in the area of true facts, they certainly made up for with scariness and the use of the imagination. The last United States body we'll look at is the Mayo Clinic. The final entry from North America in the fact-checking competition is the Mayo Clinic, a very prestigious organisation, which assures us again that controlling the blood sugar can keep you and your baby healthy in all sorts of ways. Let's start at the bottom. Preventing future diabetes, caesarean sections, stillbirth, etc., etc. None of these are true so far. Breathing difficulties, no. But they're here because they introduced the new concept of prevention of early preterm birth. So let's see what the World Health Organization says about that. Early preterm birth, Table 8, treatment effect. You'll be shocked and surprised to learn, not significant. Right, well that's it for the US. Let's head across the Atlantic to the UK. I'm sure the UK obstetricians can get their facts a bit straighter than the American ones, so let's have a look. Treatment or controlling your blood glucose reduces the chance of all these complications. The risks to the baby of being bigger than average. Well, babies, that's true. Babies are 119 grams bigger than average, and treatment reduces their weight by 110 grams or 30 grams in baby girls. All right. Stillbirth. Well, no, that's not true. Admission to a neonatal unit, no. Obesity and type 2 diabetes later in life. Well, yeah. Not true. Well, the National Institute for Health and Care Excellence in the UK understands that UK women may not be able to understand the evidence and how good treatment is, so it exhorts practitioners to just explain to the women how treatment will decrease trauma during birth for her and her baby, caesarean section, neonatal hypoglycemia, and perinatal death, which we've checked all that, haven't we? None of that's true, is it? But they introduced the concept of induction of labour. It will decrease induction of labour. The World Health Organization doesn't deal with that, so let's have a look at the Cochrane database of reviews and see what they say. Well, lifestyle interventions, which is the treatment they're talking about, including insulin if needed, may increase the number of inductions. Well, I suppose explaining is nice, but I'm not sure how that goes if it's not true. Let's move on. Well, someone in the UK must know what they're talking about, mustn't they? So what about the NHS? The risks can be greatly reduced in gestational diabetes. The risks of induced labour, caesarean section, premature birth, low blood sugars, jaundice, yellowing of the skin. You decide. Yeah, that was a bit disappointing. A lot of misinformation, but not very much imagination. Let's head across to Australia and see what's happening there. So in Australia, the most expert body is probably the Australian Diabetes in Pregnancy Society, mostly not obstetrician, no, mostly I think endocrinologists. So let's see what they say is the august body. So what they do, first of all, is they say that controlling the blood glucose levels can reduce the risks significantly. Okay, so it can reduce the risk of an episiotomy. Well, I've looked everywhere and I can't find any evidence that it does. It just hasn't been looked at. But we do know that we've looked already at trauma to the mum's perineum, tears, etc., and they're certainly not reduced. Forceps delivery, I've looked everywhere again and I don't think that's been studied. I think someone's just sort of letting their imagination run away with them in the Australian Diabetes in Pregnancy Society. Caesarean section we've looked at, it is not decreased by treatment, is it? What else? Overweight as children, no, we've looked at the follow-up of the studies, no difference in that. And not only that, the children are going to have high blood pressure, heart disease and diabetes in the future. Well, again, I think someone in the Australian Diabetes in Pregnancy Society has got a very active imagination. Now, what about, this is an information handout from one of the state governments in Australia, the Department of Health. It's a great state, Queensland. And what do they say? Well, the risk for the mother, well, what they say is that the aims of treatment are to prevent any of these complications. And which complications are you going to prevent? Increased risk of induction, you'll prevent that. Well, no, you won't. According to the Cochrane database, it's increased. Caesarean sections, no. Developing type 2 diabetes later in life for the mother, no. We've looked at that, Casey. Low blood sugar levels, no. Breathing problems, no. Now again, the Australians do have active imaginations. This has never been studied, and that has never been studied in treatment of gestational diabetes, as far as I can see. Now, last but not least, this is the Australian College of Obstetricians. Yeah, they sound like a pretty sensible lot. Let's see what they say. Well, first of all, they reassure us that the reason it needs to be treated, that treatment reduces the risk of complications. Well, that's great. And then they tell us the complications that it will reduce. Prematurity, no, we've looked at that. Respiratory distress, no. Hypoglycemia, no. What about for the mum? Preeclampsia, yes, it will decrease the diagnosis for every 10 to 20 women treated, but it makes no difference to any bad outcome. Chance of the mum developing gestational diabetes, well, maybe, I think that's true. Well, it won't decrease a chance, but she certainly is more likely to. A higher risk of developing diabetes, no. Caesarean section, no. Induction of labour, well, treatment increases your risk of that. Polyhydramnios, never been studied as far as I know in a treatment trial. But the reason that the Australian obstetricians, I think, are going to do very well anyway in the misinformation medal is if we look over here at medication. Some women will need tablets, and metformin is the one used in Australia. But the thing to know is that the medication does not cross the placenta, which is great, because if it did, it would be straight into the baby. But it doesn't affect the baby. Now, that would be good except for one thing. It's not true. So let's have a quick look at medication and the baby. Australian obstetricians seem pretty confident that metformin doesn't cross the placenta, which is odd because it's been known for 20 years. This is 2005 Vanke. It's been known that metformin does cross the placenta. I think every midwife and high school student knows it these days. Well, maybe not high school students, but midwives all do. And does it affect the baby? Well, it seems to actually, even though the obstetricians reassure us that it doesn't. It seems to maybe make the babies more overweight. It seems to affect their growth so that they're born skinnier but then their growth tries to catch up and they become heavier. So these patterns can be associated with adverse cardiometabolic outcomes in adults. Oh, geez, I don't know about you, but I haven't been able to keep still hearing about all these amazing discoveries in Australia, you know, that decrease in treatment is decreasing episiotomies in Australia, decreasing forceps in Australia, it's decreasing feeding problems in the babies in Australia, not to mention temperature control problems. But the most amazing thing, and I think we're entering Nobel Prize territory here, is for the last 20 years, while diabetes drugs have been crossing the percentages of all the other countries around the world, in Australia, it's been revealed that Australian percentages are impenetrable to metformin. Amazing. Well, we've only got one more stop, and that's across the Tasman Sea to that fantastic country, New Zealand. Now, we're continuing east, and our last visit, you'll be pleased to hear, is to New Zealand, and we're only going to look at one publication from the New Zealand Ministry of Health. And again, this is dealing with metformin, and it's an intriguing document from the New Zealand Ministry of Health to New Zealand mothers. It tells us that, well, it tells New Zealand mothers anyway, that metformin reduces all the risks for your baby listed above. It reduces all these risks. So let's see what it reduces. For the mother, diabetes later in life. Nope. Caesarean section. No. We've seen that's not true. Injury during birth, we've seen that's not true. Premature birth, we've seen that's not true. Labour, not true. I don't even know what this means, but in any case, it's not true. Jaundice, not true. Breathing problems, not true. So taking metformin, well, I don't know, maybe in New Zealand it does, but it doesn't do that anywhere else in the world. Now, the other thing is that it's safe for the baby. This is sort of repeated. It has no effect, in fact, on children's development. Well, we've just seen that there's lots of evidence accumulating now that it does indeed affect children's development and may change their physiology if they're exposed to it in utero, which they are. You know, it goes straight through the mother into the baby, and it may have effect on their obesity as children. It may affect their growth patterns, leading to inferior cardiometabolic outcomes in adulthood. So there's plenty of evidence, but maybe not in New Zealand. New Zealanders may be different. But the reason we're looking at the New Zealand Ministry of Health is because New Zealand punches above its weight in so many things. You know, rugby football is a classic example that we're all aware of. The All Blacks, they just... New Zealand just punches above its weight. And it has done the same thing here. It's lifted the bar with disinformation or misinformation. For the first time ever, as far as I know, it has introduced pictorial misinformation to the world. So babies born too early, we know that's not true. Babies needing hospital treatment, we don't even know what that means, but in any case, there's no evidence for it. But for New Zealand mothers, not only is there written information, but there's diagrammatic disinformation, just in case women can't understand the written misinformation. New Zealand. Yeah, okay, for anyone that hasn't gone to sleep or left, the time's come in the alternative universe of diabetes disinformation to announce the place getters in the misinformation medal or the cup. An honourable mention goes to the United States, not only for the Diabetes Association expressing the criticality of starting quickly, but the College of Obstetricians for just their poetic and imaginative, never seen before description of how treatment will decrease severe injuries between the vagina and anus and stress to the heart and the kidneys. And to the CDC, most of all, for telling us that treatment will make you happy. Third place goes to the United Kingdom, who didn't use a lot of imagination, but at least they want to explain better the misinformation. Second place goes to Australia. Now, Australia, they are very strong contenders for first place, I have to say, because of their description of, again, this is a landmark area where treatment in Australia will decrease forceps deliveries, it will decrease feeding problems in babies, it will decrease episiotomies, it will decrease temperature problems in babies. But most of all, just the new discovery of the impenetrability of Australian mothers' placentas to metformin well and truly deserves a silver medal. So that leaves the first place goes to New Zealand, and it's obvious, it'll be obvious to you that this is for the great effort in New Zealand to bring to the world a pictorial and diagrammatic representation, so that even if mothers can't understand written wrong information, at least they can get a picture of wrong information. That's it. Leave a comment if you feel like it. See you next time.